On the acquired coagulation disorders. So with this, itong mga acquired coagulation disorders na ito, this is usually more associated with um, disorders that are not present at birth. So ibig sabihin, this came from other elements like excuse me, other elements like you have your injury or trauma, okay? Perhaps perhaps an alteration on the biochemistry of our body, like in micronutrient deficiencies, coagulation disorders that are comorbidities with other predisposing disorders. So let's proceed with the acquired coagulation disorders. So ito class, for example, you have your hepatic disease. So we really don't associate hepatic diseases or liver diseases in bleeding. Okay? Kasi usually, ang understanding ng mga tao sa hepatic disease, this is usually more related with cancer or your hepatitis, viral hepatitis, alcoholic hepatitis. Yan yung mga knowledge ng mga tao pagdating sa hepatic health. Okay? However, if we are to analyze deeper, the purpose of your liver is it is capable of really synthesizing procoagulants and fibrinolytic substances. So if there is a presence of the liver disease, let us expect the decrease of the synthesis of the coagulation, okay, or the lysis and the destruction of your inhibitory proteins. There's also an impairment of the clearance of the activated hemostatic components. So, with this, ang nangyayari, humihina ang kapasidad ng ating atay para mag-produce ng coagulation factors. So, this is correct if you are having a disease of the liver that can potentially cause a prolonged prothrombin time. That is a sign of worsening disease because of the depression of the vitamin K dependent factor synthesis. Okay? Vitamin K dependent factor synthesis. So sa madaling sabi, you have your hepatic disease, pwede siyang makaapekto din directly sa pag-create ng mga vitamin K dependent coagulation factors. So, we have here our next or rather correlated disorder. You have your vitamin K deficiency. Again, we have here the absence of the normal flora due to the broad spectrum oral antibiotics. This is due to the irresponsible usage of antibiotics. Namamatay ang ating normal flora. Obstructive jaundice, your liver releases bile, okay, and that bile is responsible for the digestion of your dietary fats, and that fats would provide the vitamin K that is for the for the synthesis of your vitamin K dependent coagulation factors. So kapag hindi maganda ang digestion ng taba, mababa ang vitamin K deficiency. You have here your antagonistic drugs such as your warfarin and comadine, and for your breastfed babies as well. So you have here your therapeutic anticoagulation. Medications tend to overdose kapag mataas ang dosage na naibibigay sa isang client. By accident, you have an overdose of heparin that would inhibit most of the coagulation factors, most especially the thrombin coagulation factor. You also have your warfarin and coumadin that acts as an antagonist of your vitamin K dependent coagulation factor, making it not functional. So, nagkakaroon tayo ng reduced activity ng factors 7, factors 10, factors 9, and factors 10, factor 2. Okay, as I was mentioning earlier. You have here your circulating anticoagulants. This is also known as your inhibitory substances. So this is produced by the body that inhibits coagulation. So this is mostly associated with antibodies that may be due to transfusion of blood products or release of tumor substances into the circulation, and some cases of autoimmune diseases such as your systemic lupus erythematosus. Okay? So meron tayong mga antibodies that are directly attacking the coagulation proteins or the coagulation factors. And since they attack that coagulation factors, essentially they are being reduced in their number. And in it, and that would put the patient, or that would put the patient, yes, okay, that will put the patient in the deficiency state. Mababa ang coagulation factor because the antibodies are destroying that um, coagulation factor. So you have here your massive transfusion effects that is due to the extensive, or rather excessive amount of the infused citrate. Remember that infused citrate will gain or will form complexes with your calcium ions in the blood. Okay? You have your donor product that is incompatible with your patient. So, kapag nagkaroon ng red blood cell hemolysis, your hemolysis can essentially affect the coagulation factors and the effect, or the function of your platelets as well. So you also have a deficiency of the labile clotting factors, or the platelets also that is stored in refrigerator temperature blood storage container. Okay, or your blood bank refrigerator. Nasisira or bumababa ang labile factors, yung mga cold, or yung mga cold or cold sensitive clotting factors. And again, just to remind you again that once your platelets are exposed in cold temperatures, they would be altered in their shape. So their shape would be circular instead of their normal discoid shaped platelets. So artifactual or artificial surface effects. So they will cause formation of thrombi or emboli. Magkakaroon din po tayo ng consumption of the clotting factors and platelets, alteration in the function of clotting factors, and the incitement of the systemic syndromes. So, eto, napag-usapan na natin ito yesterday. You have your disseminated intravascular coagulation. If we are to consider the mechanisms of both DIC in terms of its dysregulation of the coagulation and fibrinolytic systems, we can classify DIC as both thrombotic and hemorrhagic disorder. Kung titignan mo, class, kung nakikita ang aking cursor, consumption of clotting factors. Kapag naubos ang clotting factors, that is inducing the body to form more clots. Kasi nga, nagka-clot eh. The platelets will be incorporated onto the clotting mechanism. So that will lead to the formation of thrombus formation. Class, remember, plasmin is activated by the release of the tissue activators from damaged cells. So after magkaroon ng coagulation abnormality, magkakaroon naman tayo ng fibrinolysis activity that is also abnormal. So, yung na-form na clot, agad-agad itutunawin din ng ating plasmin. So, in effect, bumababa ang clotting factors, bumababa ang platelet count, tumataas ang ating fibrin degradation products because of disseminated intravascular coagulation. So class, wag po tayong malilito doon. Okay? Okay, class. Excuse me. Okay, class, please give me a few minutes again. I'm sorry.